Dr. Shweta Shah, a gynecologist, laparoscopic surgeon, founder and director, Vameva Clinic, Mumbai. So let's get to know about a very rare but not uncommon form of an abnormal pregnancy, which is known as ectopic pregnancy. So in the last video, we all understood that the function of the fallopian tube is to bring the egg and the sperm together, and the pregnancy first starts in the fallopian tube itself. Then from there it is gradually migrated inside the uterine cavity, where the normal intrauterine pregnancy develops further. Now in certain conditions, when the fallopian tube is damaged, it is diseased or infected, the tubes will not allow the pregnancy to migrate into the uterine cavity. Instead, the pregnancy will start developing in the tube itself. This is the most common form of ectopic pregnancy, which is an abnormal pregnancy. Now, since the tubes are very slender structures, they will not allow the growing pregnancy to grow along with it, and in some point in time the tubes will give way, and this will give rise to an emergency and a life-threatening situation in a woman. Now, how do we understand whether a woman has an intrauterine pregnancy or an ectopic pregnancy? For this, because both of them are pregnancies, the initial symptoms like missing of periods, vomiting, nausea, pregnancy test being positive will be very identical. There is only two ways by which we can distinguish between an intrauterine and an ectopic pregnancy. First is doing an ultrasound scan, and second is doing a blood test which is known as beta HCG. Now, an ultrasound will easily document that the pregnancy is started to develop inside the fallopian tube. When we do the beta HCG, a normal intrauterine pregnancy will have doubling of the beta HCG values when it is done on 2 consecutive occasions 48 hours apart. If the beta HCG doesn't double up within 48 hours, it is a pointer towards an ectopic pregnancy. Now, since we have diagnosed that it's an ectopic pregnancy, how do we manage it? Now, there are two ways of managing ectopic pregnancy. It is surgical as well as medical. If the lady is diagnosed with an unruptured ectopic pregnancy, she is amenable to treatment by giving medicine which is known as methotrexate, which will cause dissolution of this ectopic pregnancy. This has to be followed up serially by doing a beta HCG, which will show decreasing values. In case of a ruptured ectopic pregnancy, there is no choice but the woman has to undergo a surgery which is known as laparoscopy or a keyhole surgery. In such situations, the woman has to compromise either of the affected tube, and therefore for subsequent pregnancy the chances will reduce by 50% because she will be left with only one tube. For further such content on women health, kindly subscribe to my channel and do not forget to press the bell icon. Thank you.